Evening, everybody. Welcome to another one of my live streams. Hope you're all doing well on this Sunday evening. Well, Sunday evening here in the UK. I realise it's either afternoon or morning for those in America, depending which side you're at. It's great to have Kat here already in the chat. She's an excellent dietitian, and I'm going to share her page in a bit. And also welcome Demi. Hopefully a few more people will be jumping on. I have had a few people that have said that they don't really want to watch this because of previous issues with struggling with their eating. And obviously, if that is the case, if anybody's joining the replay, if anything like that is going to cause you issues, don't watch this. Look after your mental health rather than finding out about all these weight loss drugs. Better talking to your own healthcare professional rather than just watching people on YouTube for that. But welcome everyone on. We'll hopefully have a good discussion about lots of different things, but I better run through my disclaimers first. So, although I have been a pharmacist for 20 plus years, this is a YouTube channel, so it's only for educational purposes. This is not for your own personal healthcare advice. Make sure that you go to your own GP, dietitian, or healthcare professional for your own advice. And obviously, I'm going to try and explain evidence-based information for you all. So, but yeah, and also be aware that a lot of what I am going to be talking about is what's available in the UK, in the UK legislation around that. Oh, excellent. Nightbot's joined the stream. I was wondering how I've set up Nightbot, whether it's actually going to work very well, but looks like he's here and working, so that's good. Hi, not that Kate. That's fine. It's good to have you here. So that's really good. I'm just going to check that everything's working through everywhere. Fine. Yeah. I have got a new microphone and I have got a new light. So this is a new setup, and I've tried some other functions on StreamYard. So hopefully getting there without too many technical difficulties. Let me know if the microphone or anything isn't working. Yeah, so just put this up. Yeah, weight loss this is a really tough topic. I am not even going to be touching the sides here. There is so many different supplements out there that come from very different angles on how they try to work on weight loss. There is also actual medications out there, and although yes, some are being used sort of on the NHS through GPs, through doctors, there is so many online prescription services that are prescribing these prescription only medications through the just clicking online, and I'm not sure that all of them have got the appropriate safeguards. And then another concerning thing that I've already found is one of these MLM companies that is partnering with online prescribing services to prescribe actual weight loss injections, medications alongside their MLM products. Yeah, there's far too much scamming content out there for people. So yeah, I'm going to do my best to work through all of these. But before I actually start, I'm going to see if Nightbot works for this. I have tried to put a link on Nightbot. Hopefully it'll work for Kat Benson's YouTube channel. Excellent, it's worked. She's a dietitian that I've been watching online for quite a while, ever since she did some lives with DC, who is another person I'm going to back to the channel for. And she provides brilliant, it's not weight loss advice. She talks a lot about healthy eating in a very sort of sensible way without being part of diet culture. because diet culture is what leads a lot of people into eating disorders. So, and she has actually convinced me enough to buy this book. Hopefully, it shows it the right way for you lot, called Intuitive Eating, which I was a bit dubious about to start with because I thought, oh, yeah, intuitive eating, that's all about listening to your body and giving into cravings. But it's a lot more complex than that. It is about listening to your body, it is about honoring your cravings and why you've got cravings, but it's also listening to how food actually feels in your body, actually making sure that you realize why you're eating. So are you comfort eating? And sometimes it's fine comfort eating if something really has happened that you need to comfort eat for, but also realizing that if you do end up binging on something, how does your body feel after then? Is that a good feeling? Is that something that you actually want to repeat? And also just as stopping as you're eating to actually think, why am I eating? Have I eaten enough? Is that enough for me? And that's one thing I've started doing, is I would eat my meal and then I would be straight there to grab a yogurt, grab a chocolate bar straight after I've eaten. And I was sort of eating pudding straight away after my main meal. And then I've actually just stopped and thought, let me digest, enjoy the taste of what I've eaten. Have I enjoyed it? Has that been enough to satisfy me? And then sometimes I still do want to eat something afterwards, but sometimes I don't. And it's just that sort of thing. So I am finding this book extremely useful. And that is one of the things with a lot of diet culture. And the reason why dieting doesn't work is the fact that you always on it when you go on a diet, you're in the mindset of diet and you cope for that time and you might even see good results, but then long term, you just put it back on. And then adding on weight loss supplements and weight loss medication, again, you've got them there to help you lose the weight, but they're not a long-term solution. They're not things that you can actually take really long term because of the long-term side effects and such like. And you're just gonna, when you stop taking them, you're just gonna revert back to your old habits. And yeah, you're gonna yo-yo diet. And quite often they've shown in the majority of studies that you tend to always go back further from where your baseline was. So it's all about culture and change. Oh, so hi Patricia. Um, Excellent. I'm not that far through the book. I've only read a couple of chapters. So I have read it in the wrong order. One of the chapters on about exercising that I've read, and I'm sorry for the frizzy hair, but I've actually managed to go swimming 4 times this week. Which is amazing for me. And it's just things like that. So we're all about weight loss. There's so much more to weight loss than just weight loss medication or make weight loss supplements. I'm going to just show you who's busy trying to get in the way. This is Nobby. He's, yeah, 9-year-old now. And yeah, he likes to get in the way. So I'm just, yeah, Demi, I flew. I've got 4 of them. I've got 2 cats and 2 rabbits. So they do come. I think. So I'm just going to just quickly share some of the different products that I'm going to run through because there's so many different angles. So if there's any of these that you actually want me to um, go into more detail on, and I can do that. So make sure that you ask your questions. But I'm just going to go on through quite a few of these. So a lot of supplements that you see that are along for weight loss quite often work by either just having a laxative effect, especially when you also see the word detoxing. Whenever they all say detox or start your weight loss journey with a detox, what you find is that quite often these are just laxatives. And you can go back to my live stream about laxatives if you want to go into deep dives for laxatives. but they're not actually helping you lose fat in a healthy way. You've actually got probably going to lose, maybe the 3 or 4 pounds of stools that's in your system if you do happen to be constipated. But you're mainly just going to be losing water because you're just going to be flushing it out quicker than your body can reabsorb water back from your intestines. So you've always got run the risk of becoming dehydrated with anything that's detox like that. And obviously, you usually find with any of those supplements, they tell you to then make sure that you're drinking your 3 or 4 litres of water alongside it so that you don't end up dehydrated. But being on laxatives, it doesn't detox. You don't need to detox. If you've got functioning liver and kidneys, they do everything that's needed to get rid of any unwanted chemicals out of your body. If you do have a problem with your liver and kidneys, then you need to be under a proper healthcare professional to look whether you're getting a build of anything in your body. So you don't need to detox for that. Unless you're actually constipated, you don't need to be clearing out the system. And actually, that can be detrimental to your intestines and your gut microbiome. Your gut microbiome actually needs to have the food in there for a certain length of time to actually create a healthy place to be living. So that isn't, that isn't always a good thing to be doing. And I can also cover a bit about your gut microbiome later on. But you're probably seeing a lot of supplements where they say detox, start your weight loss journey. You'll see that they actually contain things like, well, quite often they'll say natural senocot, but senna does just come from the senocot plant. So they tend to really overuse magnesium. For the majority of people, nobody's really magnesium deficient. And yes, magnesium can help in small amounts for people who have been dehydrated and are struggling with muscle cramps. A bit of magnesium can help with that. But they do seem to tout magnesium as a massively cure all, but it doesn't. We do need a small amount of magnesium, but it's not a magic treatment for anything. Well, the only thing that I would say, high dose magnesium, the only time that I actually see that and that it is used for that is in preeclampsia, which obviously is a medical emergency. Um, Hi, Lisa. Nice to see you here. Oh, yeah. So, yeah, I've got two rabbits, Dougal and Harriet, and they actually have a whole room built for them outside my kitchen. I actually built what looks like one of those catios, but it's a little bit more secure and sealed in. So they have their own room, which is actually as big as my kitchen. They're very spoilt. Hi, Rosie. Yeah, so caffeine. So caffeine is used by a lot of supplements. A lot of supplements for weight loss do end up having caffeine in them because caffeine is a stimulant. It helps you burn off more energy. It keeps you more alert. It stimulates your brain so that you're more active. So they do add it into a lot of um, weight loss supplements. Also, other things that sort of contain um, caffeine, like green tea, and also other sort of what you class as the natural stimulants. It's a whole range of them. I did do a whole live stream about nootropics, which are sort of natural ingredients that um, stimulate the brain, give more blood flow to the brain, increase your brain activity, and then you can actually move on to actual medication and drugs that are stimulants. So the ADHD medication, things like the methylphenidate, the stimulants, and they will cause weight loss because they really do increase your metabolic rate and burn off the energy. So yeah, so that's one thing when people are on ADHD medication, they need to monitor their heart to see whether the heart rate's been increased too much. check on the blood pressure, checking that's not increasing too much, and then also checking their weight to check that they're not losing too much weight, and especially when it's used in kids and teenagers, so that they're not losing too much weight as they're also trying to grow, so that there's no thing. Um, yeah, green tea's fine. It does seem to have some health benefits. So a little bit of green tea, if you enjoy that, there does seem to be some other polyphenols and such like in green tea that may be beneficial. Obviously, like with all of these things, it's nice to have a balanced diet with a lot of different things in. It's not known to be any miracle cure for anything, but yeah, it probably does have some benefit in a healthy lifestyle. Yeah. So venlafaxine, it's not a stimulant. It is a antidepressant, and you have the group of antidepressants which are the SSRIs, the serotonin selective reuptake inhibitors, such as the old Prozac, fluoxetine, sertraline. And venlafaxine is a newer group, which is serotonin and noradrenaline reuptake inhibitors. So it's an SNRI. And again, it works on the feedback loop of the serotonin and the noradrenaline in the brain to work as an antidepressant, but it doesn't actually have any stimulant effect. So it's not a stimulant, it is an antidepressant, but it works by two modes instead of just the one mode like the other SSRIs. Some people, you do need to check the blood pressure for people that are on venlafaxine because it can raise the blood pressure in some people. But for the majority of people, they are fine with this. It's just one thing extra to check. Yes, that is true. As you are treating your depression, if and I would say that an antidepressant alone isn't the only thing for treating depression. It needs to be alongside having counselling, having support for whatever life issues you're going through, having CBT. You need to actually be finding out what is the cause, whether you need therapy for that or whether you need a change in your life circumstances to help. But yeah, as you actually get back to life and doing more, you can have more energy and then end up having a better lifestyle once you're getting out because depression does make it extremely hard for people to have a healthy lifestyle. The motivation's not there. Um, the motivation to be able to cook nice meals, to go out and do things can make it very, very hard for people. Yeah, exactly. With ADHD medication, with them being stimulants, they can really find it really hard to gain weight on them. Also, the fact of people with ADHD are hyperactive, as in they're always on the move. So even when they are sat still, they're not sat still. They're continually stimming, shaking their legs, fidgeting their fingers. So their basal metabolic rate is much higher than somebody who can quite happily just sit and use hardly any energy. Um, and also the other thing with ADHD is people with ADHD can sometimes just totally forget to eat. They're just that focused on the other things that they're doing that remembering to eat meals regularly can be difficult. Um, One thing that I was going to share about stimulants, and this will be a bit of a trigger warning, but stimulants are quite often what I sold on the black market for weight loss, and they are the ones that are the most dangerous for causing death. And actually, I don't think I will show it, but if you are sort of interested, one if you Google um, weight loss pills, Eloise on the BBC, um, there was a big case where they did actually get the company and take them to court for um, causing death from yeah, causing death from the use of these stimulants and selling stimulants online without a license. Oh, excellent. 10 people watching. I'm really pleased at that. That's one of my highest that I've been at. I would love it if there were 19 watching. It's been brilliant. And it's great how that my channel is growing. So my migraine live stream has still been the best live stream that I've done so far. YouTube, for some reason, sent it out to thousands more people than usual, whereas last week's live stream never got sent out to people. And then, yeah, even my videos are getting sent out. So I've just done a video on calcium and vitamin D, although that didn't work quite as well. But then I've realised I thought it would be great. It's a very big topic. But then I also, when I actually searched it, there's probably a million other videos out there for calcium and vitamin D. So I'm never going to get into the top section for sharing. There is a black market. I was looking earlier, and it's not even on the dark web. It's on the white web, as we say, the normal web. Hi Amanda, great to see you. Yeah, I did actually have a look around, and it is so easy to find all of these weight loss products online, even the prescription only ones. And yeah, it's quite scary. And obviously, I know as a pharmacist, they do try and put the questions in, but it doesn't take that much to work out which questions will block you being sent through and which answers would actually get you straight through. So I'm going to carry on moving on. I did get asked about, so on the line with the laxatives, bulking agents are quite often used in many supplements. These are usually as fiber supplements, so your psyllium pus, your inulin, and they always tout that it's to be feeding your gut microbiome. And yes, they do feed your gut microbiome, but their main reason for using them is they're just filling up your stomach with bulk so that you can't physically eat as much. And when you're usually using the diet regimes for these, they are telling you to also restrict everything else you're eating, drinking a lot of water. So basically all you're putting through your body is the fiber and the water. And you do have to then think, well, you're denying your body of actual nutrition from actual food. And so along with them, they will always then be adding in your multivitamins with it, because obviously you're not getting your multivitamin, you're not getting all your vitamins and your micronutrients from actual food alongside. And then the downside from that is then once you stop taking these supplements and you suddenly go back to your normal diet, you can then end up with suddenly not having the same fiber in your diet. You can end up feeling bunged up and not so good. But then you also end up gaining all the weight again because you've actually been used to drinking a large volume of water, used to drinking a large volume of fiber, and you're still then wanting to feel that same fullness again. So it doesn't always work. There are two groups that are sort of similar. They're called binders, and they'll either bind carbohydrates using a sort of cellulose complex to stop you breaking down any carbohydrate that you're eating, so it just goes through your system. And then there's also the fat binders, of which orlistat is one that's an actual medication, but there are other ones. From natural sources, there's other plant matrix that can be used that bind with the fat and stop you being absorbed. The problems with these is yes, you're not absorbing as much calories from carbohydrates and you're not absorbing as much calories from fat, but it's got to go somewhere and you end up just excreting them out via your stools. And the big problem with all is that, and the biggest side effect from all is that, is that if you do carry on eating just as much fat as you were eating, oh, Kate's got there first, you get anal leakage. So basically, you're holding the fat from your food that you would have absorbed into your bloodstream, and it will trickle through as anal leakage, which there is nothing that you can do about because it'll just a liquid come out, and it's not very pleasant at all. And so you end up with people that are taking things like Orlistat. It actually works as a bit of a sort of an anti-abuse. You have to reduce the fat in your diet, otherwise you get side effects. A bit like the same as if you've ever I've had my gallbladder removed because of gallstones, and especially when I first had my gallbladder removed, if I had 2 lots of fat in the same day, I would then get similar symptoms. So I would find there was no way I could go for a full out Saturday of fish and chips at lunchtime from a greasy fish and chip shop and then have a full on greasy Chinese in the evening, because then the next day would not be pleasant. So, yeah, the yeah, so all is that it is still available. It is still given out on the NHS for certain groups of people. It is part of the NICE guidance. It is part of the NICE guidance to be used before the GLP-1 injections. And it's available to purchase. You can have the half strength bought over the counter, which is called Ali, but you can also go online to places like Boots and other online pharmacies, go through the questionnaires and get it on prescription through the online services privately. And yeah, it's still very well used. The other problem with fat binders is, as well as it preventing you absorbing as much fat from your diet, it's also going to be preventing you absorbing as much fat soluble vitamins, so your A, D, E, and K. So, as we've all, if you've watched my last video about calcium and vitamin D, you realise that you can't get enough vitamin D from the sunlight, and you probably are going to get a supplement. But if you're taking that supplement alongside the Orlistat, especially if you're taking them at the same time of day, that vitamin D supplement is just going to go straight out through your system. And also vitamin A, E, and K are all necessary. So yeah, not absorbing as much as them. And then yeah, you may end up needing to supplement with them fat soluble vitamins, but being careful of how you do that. Right. I've yo-yoed really badly over the last 5 years, over the last 5 years. But yeah, but with your weight, it's always best to not chase don't chase a value on the scale, and also don't look at sort of weight loss to look like somebody else. I've always, and this is one thing that this book is really teaching me. It's all about your health, and if you need that, if you do need to lose some weight for your health, then it's learning to do that in a healthy way. And that's one thing I'm really trying to do at the moment is I'm more focusing on my health than what the scales are saying. Um, because at the moment, I may not actually be losing weight because I'm probably building some muscle at the moment. With the amount of extra swimming I'm doing, I can really feel, my muscles are growing. I can feel that, the next day my muscles they don't hurt, they're not sore, but I can feel that I've worked them. So I know that I'm probably building muscle, and what muscle does weigh more than fat. And things like chasing a BMI is not always useful Because if you think of top athletes, especially ones that need strength and muscles, they can have BMIs that are 35 to 40, which is in the severely obese category, and they haven't got an ounce of fat on them, and they are super fit and super healthy. So just looking at scale. So it's all, so I'm thinking about all about fitness and such like. And then, yeah, if you do need help, I would always suggest um, reaching out and getting help from a dietitian and getting advice along them. Uh, like- So, yeah. So as I like to say, you're not overweight, you're under tall, but there's not a lot you can do about that. Um, but yeah, so I think, yeah, I have no idea whether it's licensed in Canada. I'm sure it probably is licensed in Canada. Whether it's part of the regime that health professionals use, I don't know. So yeah, so look for non-scale victories. Like I climbed the stairs and didn't get out of breath. Yeah, or I went for an extra long walk and didn't die. Exactly. I've gone swimming 4 times this week. That is a win. I have never done that other than when I've been on holiday and just used the pool sort of every day, but then I've not done the same amount of length. I have gone swimming 4 times this week and I have never done that. So yeah, being able to climb the stairs without getting out of breath, I live in a bungalow, so that's probably not going to happen. Um, yeah, and you probably do have a certain amount of fitness. So I would say always concentrate on your fitness. There's more to health than just the weight on your scales. There's so much more. So yeah, as Kate says, you're probably okay. And that's the other thing. BMI calculations, although it does take into account your height, that's why they're dividing your weight by your height twice. They don't take into an account that the fact that the body structure of somebody who's 4'10" to somebody who's 6'6" are totally different frames. Plus, you do have different frames of people. Some people are sort of a thinner frame than other people, and muscle mass, the bone density. Exactly, and this is the problem with dieting, is you end up with foods being put as good foods and bad foods. I think Slimming World has been the worst for this, with your sins, making good foods and bad food, which just puts you in the wrong mentality, because really what you have is you have calorie dense food, which are okay when you're about to do some activity that requires a lot of calories. Then you have nutritionally dense food, which are required for getting your micronutrients. And but you can't just live off one superfood either. So you've got your nutrient dense food, but you need a whole variety of them to get the whole variety of micronutrients. Just having go-go berries because they're a superfood doesn't mean that they're any good. And then and then that fetches me on to the supplements that you get, which are the greens and the reds, which are trying to say that you don't need to have your vegetables in your diet, um, just have this green supplement. And I'll mention Kat again, especially for those that have just jumped on. Kat, an amazing dietitian, she's done some debunking about um, greens, and that yes, there may be a subset of people where they may be useful, but just trying to replace a bad diet with some greens isn't the answer. Um, Hi DC, I've already shared your channel. Thanks for the info about Nightbot. It's doing well, and yeah, I think I've got it set up right. And thanks for the tips on the thumbnails. as you can see, I've used them as well. So thank you so much, DC. DC is such an amazing creator. She's so helpful and so kind and lovely to all us budding creators out there. So I do recommend you go and have a look at DC's channel. If I can check that works. Yeah. Yeah, Erin, yeah, I'm loving watching Erin's stories on Insta and how she is getting out of the MLM diet culture, the continually on that yo-yo dieting, and how she's now actually looking at after her health and going for fitness and health. I'm loving watching her story. I did think that. I did get the hints that DC. Yeah, and reach out to people with dietitians. And yeah, we've already discussed a bit about ADHD earlier, but with autism, um, the cues of whether you're hungry or not and why are you hungry don't always come the same, and you can end up either not eating or eating too much and not knowing when to do things the same. So yeah, exactly. Food is neutral, and it's okay to enjoy food, and that's fine, except for Rosie, good point. You're allergic to, and again with the intuitive eating, it is about sort of thinking about foods that you're allergic to and intolerant to, and how do they make you feel, and therefore what is best for your health and well-being is to find alternatives to those. So yeah, but yeah, gluten for celiacs, definite no. There is a definite immuno response to the protein in gluten where your body then ends up damaging itself, and at the most extremes with celiacs, that constant inflammation can actually lead to long-term problems in the gut, which do mean that no gluten. But then you've got a whole load of influence out there that basically want everybody to ban gluten in the diet. And for somebody who isn't celiac or doesn't have actual issues with it, then gluten is fine and it shouldn't be demonized. And although, yes, quite a lot of gluten foods can be high in calories, that doesn't inherently mean that they're wrong. And if you are about to run a marathon, then you need your calories. So, uh, yeah, so over processed foods. So, there is the problem with over processed foods that we don't necessarily realize how nutrient dense they are, and not just nutrient dense, but quick nutrients, as in they absorb into our system so much quicker than they otherwise would have done. Um, so, whereas when you're eating fruit, and people quite often demonize fruit as being high in sugar, yes, it does have fructose in it, but you're also getting the fiber alongside that and the water alongside that. And when you um, eat it, you're getting the whole of that nutrition. You're also getting loads of micronutrients, loads of polyphenols and such like alongside that. So there is something to go for trying to make sure that you eat foods that are less processed. But that also can come from a place of privilege, and we shouldn't always look down on people who have no other options other than to buy processed food. When you've got a mum with kids, she's out working, she's a single mum, she's out working, she's got kids to feed, and she's got to get something quick on on the table, whilst you can't have back turned to them. Sometimes there isn't the chance of buying things and making things from scratch. And there probably does need to be more education out there in all of our educational systems, and to help people be able to, cook in bulk. But again, that's privilege to be able to have the freezer space to cook in bulk and store it and have that time. So I think I've gone slightly on track, but it's great to have all these conversations in the chat. So I was the carbohydrate binders. These are sort of some cellulose complex, and there has been a couple of MLMs recently that had that. Can't remember. I want to say awakened, but I don't think it was. Or was it Elamia? But one of them. It was a cellulose complex that's basically a bit of a binder, stops you absorbing as much of your nutrition, so it goes through. So then we will move on, and so the last section, processed foods are sometimes useful, and there is nothing wrong with going and having something that you enjoy, even if it is processed. And it's very difficult. The price of food. My daughter she said to me yesterday, she went, I really fancy some strawberries and cream. Can you get me some whipped cream and some strawberries? Yeah, strawberries. £3.49 for a little punnet of strawberries. And the strawberries weren't even fully red. And I'm looking at them going, really? But a good hack for things like that is always remember that tinned food and frozen food for fruit and vegetables, tinned and frozen, can actually have more nutrition than fresh, because once it's picked, the nutrition in it starts to degrade. The vitamins in there start to degrade. But if you actually freeze them at the point of picking and canning them straight away, they actually retain the vitamins and the micronutrients so much better, and can actually be higher than fresh fruit and veg, which, and it's not all that fresh when you think of the time it's got to be in the processing, packaging, on the transport, waiting in the back room, and then out on the shelves. There's a lot of time for the nutrients to start to degrade. So, and tinned and frozen can be much more economical. Yep. Yeah, I know I'm quite good at making whipped cream, but she wanted the squirty, which is right. So I have done a standalone video previously on Ozempic. I did share on my Insta and on a short earlier in the week that there are fake Ozempic injections out there because of the global supply problem with these. I'm just going to remove this and go back to just with the global supply problems with GLP-1s. There have been some renegade people out there that have been trying to create their own black market versions of the semaglutide and the liraglutide that's out there and selling them on the black market. And obviously, we do not know the quality of them. We do not know what the other excipients in there, and there is the big danger of them causing major side effects. But then, also along them lines, there is problems with accessing these GLP-1s online without the proper checks. So you've got people that are selling these online. Some of these companies are not reputable. As we know, some of these companies have partnered with MLM companies like Herbalife, where it's actually people that do not need to lose weight are going on these detoxes and these weight loss programs to be super skinny, as in super healthy, super skinny, which isn't. You can be very unhealthy and very skinny. That doesn't, they do not go hand in hand. So you've got these being sold to the wrong people, plus they're not doing all the background checks. So there is a risk with them of pancreatitis. And I think it was 60 Minute Australia YouTube channel have done a video, which Kate asked me to look at, about some of the problems and side effects that people are having from these medications. And things like they can cause pancreatitis. And although that might only be in 0.5% of people, that means for every 1,000 people treated, 5 people could end up with pancreatitis. And when you think that these are not just being used in about 1,000 people, these are being used in tens of thousands and millions of people worldwide. So the chances of side effects and people having these rare side effects are going to become more and more common, especially when people haven't gone through all the proper checks and the proper monitoring with their healthcare professional. So for the majority of people, they will be fine. You know, for 99.5% of people, they shouldn't have any issues. But there is always a small percentage of people can have major side effects to any medication. So, just say, well done. That is really good, and I am sure that that's improved your health no end. But also, yeah, make sure that you keep doing it in a healthy way and talk to all your healthcare professionals about that. And again, with bariatric surgery, it can be extremely useful for certain people, especially like yourself, where you've shown that you are putting the effort in, you are doing the changes so that after you've had the surgery, you will carry on with those good changes. And that can be excellent. But unfortunately, there are people that have not gone through all the, I would say, all the psychological support and everything that's needed to help them post bariatric surgery. And then things have just gone undone for them after, because it is hard. Yeah. So Kate shared the link for the 60 minutes thing. That's a very good point. I do keep saying here, talk to your healthcare professional, but not everybody has access to healthcare. And yeah, I need to remember that, because we are, even in the UK, where we are privileged to have the NHS, not everybody, even in the UK, can get access to the NHS. And there is still a very big stigma against um, obese people. There is sort of, I wouldn't say it, and I don't quite know what the wording is. So it's not exactly fat-phobia, but there is a stigma, especially for some healthcare professionals, of when they see people that are overweight, they don't always listen to all the symptoms that they're suffering from, and they can sometimes be a bit too early with saying, lose weight, that'll help your symptoms, where yes and no. Some symptoms may have been made worse, and some health conditions are definitely related to weight. Um, not prejudice, yeah, that's it. Sometimes it's the underlying condition that has caused the weight gain. People that have had to have multiple courses of steroids that cause weight gain. There's quite a lot of other medication out there that can cause weight gain. Things like some of the antidepressants, like mirtazapine, it can cause weight gain. So there's lots of things out there that can cause weight gain. People who have got low mobility for whatever reason, and especially at the moment, there's waiting lists for getting knee surgery and hip surgery, and sometimes, they're well over a year for the waiting lists. And if you're in pain and you can't exercise, well, you're going to end up just wanting to, you know, you're not going to be able to burn it off, but you're also going to be in a lower motivation to eat healthy as well. Yeah, and yeah, we need to look at the underlying pain because it isn't just being obese. And another one related to endometriosis is polycystic ovary syndrome. Well, polycystic ovary syndrome is actually a metabolic disease, and one of the symptoms of it is weight gain. And yes, losing weight can help the symptoms of the polycystic ovary syndrome, but it causes weight gain and it's continually fighting and it needs help. Yeah, and yeah, it is obesity is a disease in itself that needs treatment. Um, Excellent. I'm assuming my two are back on the bed. That is really, really scary. Um, and that's the other thing is, if somebody is of a thinner build, if something is going wrong internally, it can be easier to see on the outside that something's needed. But sometimes they just wouldn't think of going and doing a CAT scan for somebody that is overweight without actually checking. Definitely, because of so much stigma out there. Um, There's usually maybe some mental health, and there is people, a lot of people on the serious mental health with serious mental health illnesses are obese, and there's a lot of the medication that are used to treat mental illnesses cause weight gain and also put you at risk of diabetes and such like. uh, no, it needs either chopping out, irradiating, or killing by some method. Yeah. So I think there's very complex. I'm not an expert on this. I'll stick to the pharmacology, but there is definitely very complicated interlinking between mental health, weight, um, physical health, and yeah, there's a lot that needs unpicking, and there just does need to be a lot more openness about looking at the whole person and getting help for the obesity. Because yes, will say we try not to focus on trying to diet, but we do need to help people who are on the extreme end and get healthier. And sometimes that does mean looking at weight loss, which is one of the reasons why the GLP-1s have been amazing for type 2 diabetics. And this is the frustrating thing at the moment with the um, shortages. And I do blame um, big pharma and these big companies that are selling on the private market all of these GLP-1s. These GLP-1s are amazing for people with type 2 diabetes that are overweight. And we would love for them to be the first or second option for the majority of people who have a higher BMI and have type 2 diabetes. But at the moment, we're on restrictions to not start any new patients on GLP-1s because there isn't the supply out there for the current patients. Even though we know full well that if you're willing to pay £200 a month, you can go get a supply from any of these private providers that you can find on the internet. Which is really frustrating as a healthcare professional when we've got these patients that are, they would be perfect for putting on a GLP-1 with their diabetes. Right, I'm just trying to work out where I've got to. So I'm going to share another page if I can present. Oh, I need to stop. I will get the hang of StreamYard. Present, share screen, and I actually found this. So found this table pretty good. So hopefully you can see that quite well. So I was going along looking at different places about sort of how easy is it to go online and get these as private prescriptions. And it's very easy. So this is both, even you non-UK people, you probably know of Boots. It is a worldwide thing, but Boots Online, I've got this, has every other online pharmacy I can think of, going through, seeing to be able to get one of these. I did go through, and I have to say, the online questionnaire that's available for Boots. Oh, I've gone the wrong way. There we go. Right. Right. Sorry about that. I'm not very good at doing. Going on it, I did go through, and I was truthful on the questions going through, and it took me a good sort of 10-15 minutes. I didn't get to the end. I didn't buy it. Going through, and it did ask me all the correct questions, and then it did actually say at the very end that if I was to go through with it, it was going to contact my GP and let my GP know that I was buying from them because of my other health conditions. So I was quite impressed at this site, but I am not as impressed by some of the other sites where people could potentially be buying these agents. And and there's people out there that even if they do have, so maybe one of the questions is, do you have heart issues? And I put yes, because I have postural orthostatic tachycardia syndrome. My heart rate goes up, and it did say, this can cause problems with people with heart rate problems. It then did say, have you ever had any GI issues? And actually, I said I've had my gallbladder removed, and it did say it can cause pancreatitis and other GI issues, and it was quite good. But not all companies are going to be doing this that are selling these online. Right. Yeah, some brand names are ridiculous. They really, really are. And some of the thing is, some of the actual drug names are pretty impossible to say. I'm learning all the I do all the biologicals at work. So we have things that ustekinumab and all of those, dupilumab, and there's some really ridiculous names. And I think they do that on purpose because then they try and make the brand name easier to say so that people use the brand name more to try and get more people prescribing by brand, knowing the brand and asking for the brand, so that when it comes off and they are a generic alternatives. But some of the generic alternative names get really, really silly. And it can make it really hard for people to know what's actually in their medication. And that's one of the common things that you'll get from patients saying, you've given me the wrong drug. And it's like, no, we've given you a different brand if you look, here's the very small, tiny writing that says that this is the drug that you're getting, and that should actually be much more at the forefront. It would help with ensuring there isn't medication errors as well if we had the bigger labeling of the actual drug and the actual drug was being used. So yeah, totally agree with that. Um, it is hard. It's hard on both ends. Being able to communicate what vague symptoms people are having, because people don't know what's wrong with them, so they don't always know which unrelated symptoms all need raising at the same time for a whole picture to be known. Plus the fact that the healthcare system's under stress that there isn't always time to go through a full medical history and go, is there other related symptoms going on at the same time? So it is really hard. I would always say when you are wanting to go, and I went um, write things down. When I went for wanting to get my actual diagnosis for my EDS, I literally wrote every single symptom down that I've ever had, and I put it all down, wrote it all down, handed it to my GP, and went, "Can you scan that into my notes?" And they did. And they has it there and it was scanned. And because it was there, it just helped make sure that everything got looked at because, yeah, it's very difficult. It does sound like a Pokemon. I don't know whether you've seen, but there's some YouTubers, some of the medical professionals out there that have got Instagram and things do ones of, is it is it a drug or is it a Pokemon? Or is it a drug or is it a dinosaur? And they're really funny. But the majority, I get them. They are quite a lot American based, and America have totally different brand names to the UK. On the whole, we have the same drug names, but we've still got some historically that are different. So paracetamol and acetaminophen is one of the main ones. And then obviously you've got a whole load of brands that we don't have because, yeah, quite often there's differences between countries because of what sounds good in different countries and whether there's any sort of slang that it means that it might mean something different in other countries. Um, that is really good. And there is a lot of people like to stick with the same brand. Oh, excellent. My time on not Nightbox worked. Oh, I don't know whether paroxetine does this, but amitriptyline, if you leave amitriptyline on your tongue too long, um, before you actually swallow it, it turns your tongue numb, which is really annoying. Uh, 15 minutes. Some places, well, for most of the UK, it is 10 minutes, and then some consultations, it's 7 minutes. So, yeah, they can be really difficult. They did ask, we were asking, having a discussion, and they said, how long would it take you to do a medication review, a full medication review? And I said, well, it depends on the amount of medication a patient's got, but 10 minutes isn't sufficient. 10 minutes isn't enough to go through and check that you understand what each drug's for. Is it still needed? Is there any side effects? And is there anything better? Are you remembering to take it properly? Is there anything we can do to help you take it properly? And go through that for all of them, check for interactions. Yeah, you need a decent amount of time. I'll just go back. I'm going off point, but I'm hoping you're finding this useful. Make sure you are asking any questions that you've got, in case I don't get round to it. But I did find this um, this table that they put on there very useful. So you can see there's the orlistat, so they're giving the orlistat out, and it says that, it reduces how much fat your body absorbs. I do like the way that they haven't really put side effects in this list, so it doesn't say the side effects of stomach cramping, fatty stools, anal leakage, reduced vitamin absorption. It doesn't put that; it just does the things. But as you can see, it's only a 5% weight loss after a year's through. And as you can see with all of them, they say with lifestyle changes. None of these medication, none of these interventions work without lifestyle changes because it is still calorie input over calorie output. And although you can do things to help change your metabolic rate and such like, increase your activity, it is still the dynamics. And each of these drugs is modifying one of them in a way. So the preventing the fat absorption is reducing the amount of calories that you take in. The stimulants, they're trying to increase the amount of calories that you use. So there's still always calorie input over calorie output. Even drugs that cause weight gain, the reason they do is because they may be reducing your metabolic rate so that you gain more weight, or they increase your appetite so that you eat more. So everything is all still a factor of calorie input over calorie output. And I know there is some differences with how well you absorb with your microbiome and such like. So what calories say on a packet to what you actually eat can be different. It is still calorie input over calorie output. And as you can see with all of these, it's with a lifestyle regime. None of these medications are worth anything if you're not having the lifestyle change alongside them. And I think this is one of the big misconceptions that people get in with these weight loss injections, is they're thinking that they can carry on with exactly the same lifestyle, have these injections, and they'll lose weight, when actually they won't. So problem is that these GLP-1s, they work by acting on the signals between the stomach and the brain, which is very useful in diabetes. It's that signal between you getting full and then signaling to your brain to process the carbohydrates that you've taken into your system, and making sure that you utilize carbohydrates, and then you don't use your don't whether you store it as fat if you don't use it. So it's got its main function is on blood sugar levels, and it will help you feel fuller for longer. Sorry for the background noise. That's my cat trying to use the cat flap. He pretends he can't. He pretends he can't use it, but he can. So yeah, so it's great for blood sugars, and that's why we do love the GLP-1s. They were made to act on the GLP-1 system, which is part of the feedback loop with insulin resistance that is the problem in type 2 diabetes. And then they realized that the majority of people who take, and this is for the majority of people who use it for the type 2 diabetes, as well as getting improved blood sugars, there was some weight loss, which was a big turning curve for diabetic medication, because up until then, the glycosides and the sulfonylureas, they caused major weight gain. As soon as you put somebody on insulin, insulin itself causes weight gain, because insulin takes the sugar that's floating around into your body and helps your body store it. So that's how it removes it. So this was one of the first drugs that really reduced weight as well as treating the diabetes. And then that's why with the reduced body mass of people with this, that it got used as went for the licensing for weight loss. And obviously, these companies realised that yes, there was a big market out there for being used on the health services in different countries for type 2 diabetes. They also realised there would be a much bigger market out there for promoting it as a weight loss drug, which is what they've done, which is why they've not been able to keep up with demand, and which is why we've got shortages in it, even though there's 4 different ones. There's exenatide, liraglutide, semaglutide, gelagatide, and I think there might be even a couple more. Probably there's other ones in other countries from other manufacturers that are not here. So, well, as they all say, it's got to be alongside. And then even so, you have the weight loss with it. And with type 2 diabetes, somebody's probably going to need to be on these either, unless they can get their diabetes into remission, if they can actually lose enough weight and actually fully get the diabetes into remission, they are going to be on it long term. But is it going to be sustainable for people to be on these for long term for weight loss? It shouldn't be, because you should get to your target weight and stop it. But then if you're stopping it, your body is then going to rebound if you haven't actually got the lifestyle advice, lifestyle changes fully in. And even if you've got some lifestyle changes in, but you're also relying on the weight loss injections to keep that weight off, you're going to rebound. Right. There is that. So that's why they had to do separate trials to see whether it was just the diabetes being under control that meant they lost weight, or whether it was actually helping them lose weight. And that was one of the reasons. And it does seem to do both. It does cause weight loss in itself, and it does improve sugars in itself, which is why they've actually had to do trials in people without type 2 diabetes purely for weight loss. And they have got those studies that show that it purely for weight loss, even without type 2 diabetes, it does cause the weight loss. But yes, you can never use correlation and causation, because then you would say that eating ice cream causes shark attacks, because in the summer, more people eat ice cream and there are more shark attacks. You've got there that you've got a correlation, but that is not causation, because the eating the ice cream is not the cause of more shark attacks. It's the more people on the beach, and because there's more people on the beach, they both eat the ice cream and the shark attacks. So you can't just use correlation and causation. You've got to do the actual studies in the correct amount of people and do all the corrections. So yeah, so yeah, and that's it. There is problems. The Ozempic, they're not perfect. And as I've mentioned, the side effect of pancreatitis, which is very rare but very serious, but for a lot of people, they say they have less appetite. Yeah, one of the mechanisms with how these GLP-1s work is that they lower your appetite. So it works on the signal between your stomach to your brain and helps you know that you feel fuller for longer. So it helps on that signal. So it helps you feel full and then feel that fullness for longer, so that you're not then um, wanting to go back and eat more. The problem with that is it's not just that you have less appetite. If you then try and override that and continue eating at the same rate, it then can cause nausea because you're trying to eat. So imagine you're stuffed after your Christmas lunch and then you try and eat a bit more, you get nauseous. But you're getting that at a much lower rate when you've got the Ozempic. And for some people, it can actually, that nausea can then lead to vomiting and stomach cramp and a whole host of things. So for a lot of people, they can't tolerate it. I know of someone who got online, got the online supply of their Ozempic, thought it was great, went out that weekend with their friends, to the all-you-can-eat buffet and thought, great, I'm on these weight loss injections, I can go out and enjoy myself. And they actually just spent the whole evening feeling nauseous and then ended up throwing up and not enjoying the all day at all. And it's getting these online providers are not giving people the realistic expectations of, yes, it's going to help you restrict your food. And then also because you've restricted your food, you've then got to actually start thinking of, I can't just fill myself. You can't just fill yourself with calorific dense foods, because then you're going to not be having your nutritionally dense foods, and you could end up having problems with um, deficiencies in some areas because you're not being able to eat enough because of the nausea and the vomiting, and you're not being able to eat enough to get sort of all your micronutrients and such like. Right. So gastroparesis. Now, gastroparesis is a condition which a lot of people with Ehlers-Danlos syndrome get. And basically, gastroparesis is the stopping of the gut. It is basically where the gut just stops its peristalsis and it doesn't move. And you'll have food that just sits in the stomach for, usually after 4 hours, it's emptied out of the stomach into your intestines, but it just sits there and doesn't move further along. When it sits in your intestines, it doesn't move further along. And a lot of people with gastroparesis end up vomiting because they just can't do it. They've got severe constipation because nothing moves through. And it is really, well, it is quite a medical emergency because you're not absorbing anything. And quite often with people with gastroparesis, they end up either having to have tube fed further along the intestines to try and push it through, having stimulant laxatives, having stimulant medication for moving the things along. And some of them even on, I know of somebody who has gastroparesis that badly that they are actually on intravenous food. So they have a PICC line with intravenous food with all their nutrition because they literally cannot absorb any food. And that is, my friend who's got it is because of the Ehlers-Danlos syndrome because it's that severe. But yeah, it is the side effect of these drugs. So yeah, these drugs aren't suitable for everybody. And if somebody's more at risk of having gastroparesis, say people with connective tissue disorders, then they may be more at risk of this side effect because of the risk factors adding up. Oh, yeah. There's always people that will make judgments, and we really do need to start being less judgmental of other people. Um, because we don't know a whole back history and what they're doing. When you see people get judged if they're obese and they're going swimming or to the gym, and it's like, well, actually, you don't know where they've come from. And I don't know the backstory, but there's this woman on TikTok who's been getting a lot of hate because she's obese, but she's doing the I'm walking every day, and she's got to like day 200 and something of walking every day, and she's blogging her journey of doing it, and she's making little improvements every day. But people are so judgmental of why she got to that position, and sometimes we have to go, yeah, we've got to have we've got to have compassion for people of, yes, things in their past have led them up to getting to this point, but they're trying to change. Oh, yeah, gastroparesis for bunnies is very, very deadly. Um, Probably TMI. You might want to shut your ears for 2 seconds, but rabbits have to digest their food twice. And to do that, they have to eat their first pass poop, called coelentropes, and then digest it a second time. And because of that, if they ever, for any reason, have gut blockage on, stasis, so they call it sort of gastrostasis for rabbits, it is a medical emergency for them. And I did have it with one of my girl rabbits when she was spayed. The next day, she stopped eating, and I had to take her to rush her to the vets, and I had to give her injections to get her guts moving again, moving along. So yeah, it's something very important for rabbits. They've got to continually eat. They've got to have access to hay all the time, and if they're not dozing, they've got to be eating. Great life. I'd like to do that. But they're eating, they're eating hay or grass. So it's not that nutritionally dense, hence why they have to digest it twice, hence why they've got to eat so much. It's a bit like pandas. They only eat bamboo, which is not very nutritionally dense. So they've got to sit and eat continually to get enough nutrition out of it. But yeah, same thing. One trick for bunnies, if they are struggling with gastroparesis, is pineapple juice. Yeah, a lot of people just need to look at their own health. Yeah, I do struggle with empathy for some people. Well done. That's excellent. Yeah. Oh, yeah, that's got nothing to do with them. They don't know what the whole diet is and what's appropriate for them, what allergies they have, what other conditions that they've got going on. So no, you should never make judgments about other people. I'm going to go back to um, uh, I have to say this is a big issue, as well as being slightly larger than I should be. I do have quite big chest, and it's not as firm as it used to be. But trying to look for sports bras is very difficult because they don't do sports bras in big sizes. It's as though as soon as you're over a certain size, you're not allowed to do sports anymore. And it's like, well, I need to, otherwise I'm going to give myself a black eye. Yeah, that would also be good. Um, I do like compression. If anybody on here suffers with sort of any postural orthostatic tachycardia syndrome or anything like that, where your blood um, falls to your ankles, you get swollen ankles and things, compression socks, compression tights, and compression leggings are a lifesaver. I actually quite often will, if my legs are swelling, I've got varicose veins, I'll quite often use flight socks during the day to help. Yeah, I have to say my vets is brilliant, and even when I've had to rush over there, um, rabbits have very, very thin, delicate ears. So when I had two rabbits fighting and one decided to bite through the other rabbit's ear, it was a bit of a mess. And I phoned up my vets and said, I'm coming. And they were there ready with the operating room as soon as I got there. Uh, yeah, I try and be tolerant. I'll try and, but yes, I won't have any bullying now. So yes, there will be no bullying. I will block anybody that bullies, and I have the right to do that. This is my channel, so thank like you. I try to be. You're keeping me busy with all these chats. So, I like the idea of having donuts on clothes. Oh, hi Christina. Yeah, that's the other thing. If you're skinny but big, you're on one extreme and the other extreme. Yeah, they really don't cater for you. I will let you all know. I am going on a plane soon. I'm going up to the top of the. I'm going up to Iceland, so I will let you know from the plane whether I think the Earth is flat or not. Yeah. So I was just going to talk about one more drug that's now on the market. It was on that slide that we just looked at. I'll share it again. So there's this new one here um, called tirzepatide or Mounjaro, and it's a GLP-1, the same as the glutides, works on that pathway, but also works on another pathway as well. So it's like a double-edged sword, and it's just been licensed and NICE approved in the UK for use in diabetics. I think it's already being used over in the US for diabetics. But because it's working on two pathways, so basically it's acting as two drugs because it's working along two pathways. It also has even more of a um, weight loss effect. And as you say, they've shown that up to 20% after 17 months use with lifestyle changes. So obviously everybody has to be on the right thing. But this has been put on the market. But even though we've only just got supplies for type 2 diabetics, as you can see, it's here on sale privately for people as a weight loss thing. So it is quite frustrating that at the moment we are getting these medications and they're jumping onto the private market even before they're ending up on the NHS. Um, so compression clothes, they're usually used. So um, com- compression clothes. There, some people use compression clothes to try and slim themselves and make them look thinner. They don't really work that way because there's still the fat there. You're just squidging it in different positions. It can help you then keep off fluid because you've got compression on you. It's keeping that pressure on your cells and your blood volume, so you are more likely for your kidneys to excrete some of that fluid off. Um, so you may lose a little bit of water weight as you wear compression clothing, and it may streamline, it may keep your lumps and bumps in a streamlined position. But when it comes to using compression to try and look thinner, it's more you just look smoother rather than actually doing anything to your um, position. However, it does come in very useful for certain people with medical conditions. So if you've got a condition where your legs swell for whatever reason, whether you've got poor um, lymph drainage back up or you've got poor circulation coming back up, so people with varicose veins, people with lymphedema, and their legs swell with gravity, keeping the liquid in their their legs, and even people with lymphedema, they can end up with fluid down their arms and being the hands and their arms actually being bloated and full of water. So the compression garments can help then force that water back into the bloodstream to be excreted and not being in the tissue there. Some people that have low blood pressure, especially low blood pressure on standing, the compression leggings and compression socks can help keep the blood flowing back up to the heart, to keep the blood pressure up and stop them from fainting. That's the reason that I tend to use it, because if I stand up too quickly, my heart rate goes up, my blood pressure drops, and I get dizzy. So compression works well for that. Another time that compression can be used is in the prevention of things of like DVT, so deep vein thrombosis, which are clots in the leg. So some people on certain medications can be at higher risk of clots, or you can have family history and genetics to be at high risk of clots. And sitting for a long time, sitting still for a long time can increase the risk of clots, as can going on flights. So that's quite often why you'll have flight socks, which are compression socks, which you wear to help reduce the risk of deep vein thrombosis from that. So I will be wearing my flight socks when I fly to Iceland to make sure that I'm lower my risk of deep vein thrombosis, as well as making sure that I do my ankle exercises, leg exercises, even when I'm sat, and then getting up and walking around, keeping myself hydrated as well, reduce my risk of having a clot, even though it's not a long haul flight to Iceland by any means. Yeah, I am visiting Iceland. I've visited 3 times before. I love Iceland. I did do a geology degree for fun. I did the last year's the last year dissertation on the the Lakey eruptions in Iceland from the 1700s, which caused fluorine poisoning across the whole of Europe from the eruption. So that's what my final year dissertation was on, and I am very interested in all the action that's happening there at the moment on the with the lava fields. They have opened up the Blue Lagoon, but you've got to drive the long way around to get to it at the moment. Although from the looks of it, they have done a path over the lava, so they might be opening a road over the lava to the Blue Lagoon. So yeah, I have seen the curve before. I've flown all the way to Hawaii and back, so I definitely know that the world is a globe, and it's not a perfect sphere either. It's flattened at the top and the bottom. Yeah, and some people with really, really extreme lymphedema, it can cause the legs to swell so much. The pressure is comforting. Weighted blankets is comforting. A lot of people with neurodivergence, because they struggle with sensory input and knowing what their body's doing, especially with things like dyspraxia and having a lack of proprioception, knowing where the body is in space, by wearing compression um, clothing can actually help them know what their body's doing, and it helps them feel safer. It also makes them more coordinated. So it's one thing that OTs recommend for people with dyspraxia or lack of proprioception to help. Also, weighted blankets really help with autistic people that are struggling to sleep. Um, That compression gloves are also really good when you've got eczema on your hands and you want to stop scratching. You can then put some nice cream on your hands and then put cotton compression gloves on. Yeah, he that's one of the big things that I can't do. I cannot have a hot shower. I have a hot shower, the heat will just cause my legs to swell and yeah, I faint. I got banned from hydrotherapy once because went to the hydrotherapy pool for the physio. Was doing my physio exercises in the nice warm hydrotherapy pool. Went into the really warm changing rooms to get a shower, and I ended up fainting. So I got banned from hydrotherapy. So I now go to a nice cold swimming pool. The local swimming pool's nice and cold, and I don't fall over there. They've also got a seat in the shower area if I do need to. Um, Actually, the Gulf Stream goes up to the south coast of Iceland. So where Reykjavik is on the south coast, on that peninsula, it's actually fairly warm. It's not actually that much difference to the UK. So a little bit colder. It's more the wind chill. They have a greater wind chill factor than the UK, but it should be fine. They have got a bit of snow, but then they're also having rain. We are hoping that we'll have some clear nights, so we might have a chance of seeing the aurora borealis, the northern lights. Yeah, yes, it's an oblate spheroid. Yes. Right, there are. So semaglutide does have a oral tablet form. So, but the dosage is quite a lot different. The reasons these were made into injections is because the actual bioavailability through the stomach lining for these is fairly low. They're quite a large molecule, and they're not actually absorbed very well. So yes, there is some tablets, but the dosing that you need on the tablets is significantly more. I think we were working it out. It's about you need about 14 times the dosage in a tablet to what you have in the injection to actually get it absorbed into your system. So although there is the alternative with the tablets, they're not recommended. Also, there's no outcome data for the tablets. So although the tablets have been licensed and they do lower blood sugar levels and do lower weight to a certain amount, they don't have the same endpoints and great evidence as the actual injections do, especially when it comes to treating type 2 diabetes and actually helping prevent cardiovascular events. So the good thing with the GLP-1 injections is that they've shown if you treat people with type 2 diabetes with them, it also lowers their long-term risk of cardiovascular events and the risk of death, which is the outcome we're all wanting. It's not just keeping blood sugars under control. We actually want to help diabetic people live healthier and live longer. And it does actually show that with the injections, but the tablets actually don't have that endpoint. So we don't recommend the tablets, although they are there and we've got them there available for possibly use in an emergency for maybe a month where we cannot get hold of any supplies of the injections. I wouldn't recommend using them. Yeah, that's the brand name of the tablets. Yeah, it's the semaglutide tablet. It's only the semaglutide, as far as I know, in the UK that has a tablet form. I don't think any of the others do. Yeah, the same mechanism as well. My hands go through. I've got a bit of brain oil, so I can go through every colour imaginable with my hands. Yeah, obviously the injections are there as a weekly injection, but yeah, tablets you've got to take daily. Uh, you're welcome. I can't remember. I've had so many comments. I'm struggling to remember who's asked what today. Yes. So, but yeah, you can see the aurora borealis in Alaska, the Scandinavian countries right at the top, Iceland, top of Canada, and then if you go to if you go to Antarctica, you will actually see the aurora australis, the southern one, and it's to do with the magnetic fields of the Earth taking the the mass ejections from the sun, taking them into the poles. I did enjoy that, them lessons in the geosciences. I've seen the aurora borealis 2 out of the 3 times that I go to Iceland. So I've visited before in September. This is the first time visiting in February. So yeah, I really, really did not like the yeah, I think you were doing it on your channel. Was Erin doing it on hers as well? I really don't like the promotion that they've got of get our nutrition pack, sign up for us, and we'll put you in touch with a prescriber who will give you these GLP-1s. I am not convinced that they're only going to be targeting people with a very high BMI. I'm not convinced that they're going to go through all the um, correct screening questions to make sure it's safe for those patients. And also, they're not doing it alongside good lifestyle changes. They're doing it alongside a starvation diet, which probably will make it easier to cope with the starvation diet because you'll have some suppression of your, wanting to eat. Yeah, and yeah, ridiculously expensive. They'll probably be raking it in. But yeah, so if anybody wants to know any more details about Herbalife, about why the MLM business structure is basically a total scam for 99% of people who are used as distributors, but won't actually be making any money. They're just doing the advertising. If you want to know anything more about that, you go over to DC's channel. She is excellent at explaining that, as is Erin Bees and Julie Joe, and also Kat, who is a dietitian on here. She's very good at Pat is also very good at exposing some of these companies as well, and some of these weird and wonderful supplements that they come out with nutritional claims that are not there. So you can go to both of their channels. They are brilliant. And thank you, Nightbot. Hopefully those links work. Oh, Mathalites. I've never heard of those. But I'm all for any sort of geological, meteorological phenomenon. Oh, we do. I would love at some point the three of us being on a stream together because I think that would be brilliant. Kat, if you're ever up for that, me, you, and DC, we'll let DC do all the technical difficulties, and we'll yeah jump on and provide some science. Oh, Arthalites. Okay. Um, did anybody have any more questions on any particular? Yeah, I've heard of St. Anthony's Fire. I can't remember it off the top of my head, but yeah, I love watching anything that's like that. But yeah, thank you all so much for joining me on here. It's great. I think I've had the most people on this live that I've ever had. So I would appreciate it if you like the stream, and if you've liked the content that you've listened to today, if you subscribe to my channel, all my previous live streams I leave up for you to go back and look through, even if you want. Some of them where I've done several subjects, I've tried to put timestamps in so that you can jump to the timestamp of the particular topic. I don't think there's any way of putting timestamps in today. I've been all over the place. But yeah, feel free to watch back things on double speed and skip. It still gives me the watch hours. If there's anything in particular you want me to cover in future live streams or to do one-off videos for, just send me a comment on any of my videos, because I'm currently reading them all because I don't have that many. or send me a DM on Insta. And yeah, have a look back at my previous videos. I've just uploaded one on can you overdose on vitamin D and calcium? I did one on statins. And my plan for my next video, I'm halfway through writing the script, is fulvic acid supplements, which fulvic acid you get from the mud from certain rivers and peat bogs. And there may be a little bit of evidence that there's some use for it, as long as you don't get any lead or other contaminants in it. So, but yeah, that's my next video. So thank you all for joining me. Really enjoyed seeing you all on here. Don't worry, I've loved the chats. Yes, we can all have difference of opinion. There's a lot of difference of opinion within within healthcare professionals. So on exactly all the nuances. So don't worry, we can have discussions on here. We can try and look at the actual facts, look at the actual science, look at the actual evidence. Thank you for knowing it's from Eloise, from Eloise and Abelard. So that's where my name comes from. It's not from Louise, it's from Eloise. There is no U in it, but there could have been a H. So thank you, Rosie, for knowing that. That's good. But yeah, thank you very much. I've really enjoyed this again. I'll see you again. I may not be here in 3 weeks' time. It may have to be 4 weeks, because 3 weeks' time is Mothering Sunday here in the UK. So I'll probably be visiting my mother. Yeah, it is a minefield, and I know there's some people haven't come on because it is a triggering subject for them. So thank you all for coming on and joining me. But yes, and helping me keep the balance and nuance. And I have to say thank you very much for Kat being on here as well. I really appreciate her jumping on.